Pregnancy and welcoming a new child into the world is a joyous time for families. Births are celebrated, and many friends and family members offer advice to new parents on how to raise well-adjusted children. 8% of children, though, are born weighing less than 5.5 pounds. These children are at higher risk of physical and mental disabilities, including vision and hearing problems, chronic lung disease, and cerebral palsy. The human cost can be difficult for families, and children need proper support and care to overcome these obstacles so early in life. And there is a cost to taxpayers. Where the average birth costs around $3,200, the average outlay for low birth weight babies jumps to $27,200. And for the most fragile in this category, those weighing less than 3 1/3 pounds, the average charges come to a staggering $76,700. Given that 45% of all births are paid by taxpayer-funded Medicaid, this becomes a critical policy and budget issue for the states. Fortunately, there are at least 5 effective policy strategies for state legislatures to decrease the number and cost of these births, resulting in a healthier population and a reduced tax burden. One of the emerging strategies that promotes healthy births is to support preventive health care, not just when women are pregnant, but before and in between pregnancies. Sometimes called preconception care, preventive care before pregnancy aims to educate, screen, and treat women of reproductive age on an ongoing basis, whether or not they are planning for children. Almost half of all pregnancies in the United States are unplanned, which is associated with higher rates of premature births and low birth weight. For example, the Preconception Health Council of California is a public-private partnership that provides information and guidelines for the public, peer educators, and health professionals, giving women the tools they need to make positive life decisions in planning for pregnancy. At least 3 states, Alabama, Georgia, and Louisiana, have used Medicaid waivers specifically to provide care between pregnancies, known as interconception care, for women who previously gave birth to a preterm or low birth weight infant or had other complications, and who no longer otherwise qualify for Medicaid. Such programs usually provide case management and other services to improve their chances of having a healthy baby if they choose to become pregnant again. The second strategy is to promote effective, high-quality early prenatal care. Prenatal care can detect complications early and manage health issues in a timely manner to reduce the risk of poor outcomes for mother and baby. Prenatal care can promote healthy behaviors, such as not using tobacco, alcohol, or drugs during pregnancy, and can treat diseases or conditions that may threaten the baby's health, such as diabetes or high blood pressure. Providers agree that the sooner the better is the best policy for accessing prenatal care during pregnancy. In some states, however, 20% or more women do not start receiving prenatal care until the 3rd trimester, or do not receive any at all. Infant mortality rates are 5 times higher for infants born to mothers who receive no prenatal care compared with mothers who received appropriate prenatal care in the 1st trimester of pregnancy. States have expanded Medicaid eligibility for pregnant women to help ensure that they have access to prenatal care as early as possible. As of January 2014, 30 states and the District of Columbia have expanded their Medicaid eligibility to cover pregnant women at twice the poverty level or above. As of January 2013, 31 states and the District of Columbia have presumptive eligibility, allowing pregnant women who access prenatal care services while eligibility is being determined. The third effective strategy is to ensure babies are born at the right time. States appear to be reversing a trend of births performed early without a medical reason, known as early elective deliveries. Deliveries before 39 weeks increase the risk of breathing and feeding problems and blood infections, which may result in longer and costlier hospital stays and even long-term health problems. The U.S. Department of Health and Human Services estimates that a 10% drop in these elective deliveries before 39 weeks would lead to more than $75 million in Medicaid savings each year. South Carolina reported saving $6 million in just the first 3 months of a program that does not reimburse hospitals for elective deliveries of babies that have not reached 39 weeks of age. Since 2011, at least 5 states, Iowa, Illinois, New York, Texas, and Washington have passed laws to reduce early, non-medically necessary elective deliveries. Another way states can save money is by providing babies with a healthy start. Checkups are very important in ensuring an infant's health. Newborn screening programs identify problems that may be treated or corrected early, such as metabolic diseases or sickle cell anemia. The National Center for Hearing Assessment and Management reports that detecting and treating hearing loss at birth for one child saves $400,000 in special education costs alone. Medicaid covers children's screenings for physical, mental, developmental, dental, hearing, vision, and other tests to detect problems and treat them early. Only 62% of children, though, eligible to receive screenings through Medicaid's early periodic screening, diagnostic, and treatment benefit were screened in 2012. Improving screening rates can reduce Medicaid costs by catching problems early. Only Iowa met the nation's goal of screening at least 80% of children enrolled in Medicaid in 2012. And for our final effective strategy, consider the health of women and children in all policies. In addition to ensuring their Medicaid programs are achieving optimal health for pregnant women and babies, legislators can work with their health departments, insurers, providers, and advocates to give babies a healthy start. They can also learn more about how they can help achieve goals set through their state's Maternal and Child Health Services Block Grant, known as Title V, whose mission it is to improve the health of all the nation's mothers and children. Making wise investments to give babies a healthy start pays off in many ways. We have reviewed 5 strategies. Improve women's health before, after, and between pregnancy. Promote effective prenatal care. Ensure babies are born at the right time. Provide babies with a healthy start. Consider the health of women and children in all policies. The National Conference of State Legislatures provides information to state policymakers on all of these issues and comparative data from all 50 states. To learn more, contact NCSL at health-info@ncsl.org.